Hello YouTube, this is Dr. Haverkorn with another tooth abscess. This time it's coming from tooth number 29 in the vestibular space. I put an X on the tooth and circled the abscess there for you. Boom, not even 20 seconds in and you already got the pus I know you came for. So, I know you want to see it again. Let's back it on up and I'll show it to you in slow-mo. You can come closer. We'll just leave that little hole right there to heal on its own. It won't take very long, maybe just a couple days, and that hole will be gone. But in the meantime, it'll let any new infection drain out. Here I'm just using some sterile saline to rinse out that abscess cavity, just make sure there's nothing else in there, try to clean it as best as we can. You'll see us do it again towards the end of the video. Check the tip on there. It seems a little loose because it was like kind of leaking a little bit on the surrounding. Now I need to take the tooth out. So we'll put a little gauze there to catch anything that's oozing out, blood or pus. And then I'm going to use my number 9 periosteal elevator, probably the oral surgeon's favorite instrument, to go around the tooth and separate the junctional epithelium from the tooth. This is a little bit of gauze so that the patient doesn't swallow the tooth if it comes flying out, which it sometimes does. And then I'm using a lower universal forceps. That's a number 150 forceps to just wiggle the tooth out. Notice it's kind of a twisting and rocking motion, more twisting than anything. Kind of like you're trying to unscrew the tooth, I guess. But as it gets looser, I'll go back and forth with more of a rocking motion. It's also kind of slippery, so you'll see me have to reseat the forceps a couple of times, but we'll get it out of there pretty quick. The other tricky thing is the tooth right in front of it has a cavity, and I'm trying not to break that tooth off while I'm getting this one out. The patient will come back later and get the other tooth out. Success! Here comes the tooth. And here's a pretty good view of it, and I'll show you an even better view at the end of the video. I decided not to use a drain in this particular case for a couple of different reasons, but I expect that this is going to get better pretty quick with just some antibiotics and a little bit of time. Okay, we're just putting a little gauze in there for the patient to bite on. And then let me show you the tooth. You can see the cavity as well as the periapical lesion. That lesion could be a cyst, it could be an abscess, or it could be a granuloma. You need a microscope to know for sure. So, thanks for watching. If we can help you, give us a call. Please remember to like, share, and subscribe.